Hello, my name is Dr. Brian Raid and I'm a naturopathic doctor, and this is a video about a really important thing to rule out if a person's suffering from chronic fatigue issues, low stamina issues, doesn't have a whole lot of get up and go. Fatigue is one of the most common symptoms when it comes to any type of underlying medical condition, and that makes sense because there's something stressing the body out, and therefore some energy is being wasted, so to speak, dealing with that problem, and so fatigue will ensue. So very, very common. There's a million and one things that can cause fatigue. I mean, it ultimately boils down to mitochondrial dysfunction because the mitochondria make all the energy for our cells, but a number of things can compromise the way the mitochondria work. But in terms of looking at things in a little broader strokes, a lot of my videos, of course, talk about things like mold toxicity, heavy metals, chronic infections with viruses and the Lyme bacteria and different things like that. And those are all really important things to have on a differential diagnosis list when there's persisting fatigue. But one of the conditions that's not talked about a whole lot, it's certainly talked about in some circles a lot, but it's not something that's quite as upfront and center as things like mold or Lyme or things like that. And that's dysautonomia or issues with the function of the autonomic nervous system as it relates to blood pressure, heart rate, things like that. So conditions like something known as POTS, which is postural orthostatic tachycardia syndrome, which is kind of just a fancy acronym for saying that when you're up and about doing things, not just lying there relaxing, your heart rate increases too much and it causes symptoms, or something called orthostatic intolerance, which is where there are inappropriate blood pressure changes that occur when you're up and about doing things, not just lying there relaxing. So you can imagine that if a person says, wow, like my stamina is just really low, like I start exerting myself, I start walking briskly, or I start playing with my kids, or I try to exercise and then my heart rate jacks up, or my blood pressure seems to fall out from under me, or I just get really tired and depleted or feel weak. Those are symptoms that can come from either this POTS condition, orthostatic intolerance, or sometimes other things. But it's in my experience, it's really important to screen for that. In the last couple of weeks, I had a couple of patients that, one of whom I hadn't seen for a really long time, and then they came in, kind of looked at their case through fresh eyes, and just mentioned like, yeah, like my resting heart rate's like 100 beats per minute. It's like, that's not normal at all. We need to investigate that. So we did this test called the NASA Lean test. NASA, like the space agency, Lean test because you're leaning against a wall for part of the test, and it's a screening test for POTS and orthostatic intolerance. And sure enough, we found an issue there. Had another patient I've been working with for a while, and we've been plugging away at certain things, got some gut stuff improved, etc. And so making some good headway, but then came up that the prevailing symptom that was kicking around was still energy depletion and dizziness. And so did the test, and lo and behold, major issue with POTS. So even myself, of course, I'm human and fallible like all of us, but I try to be a really discerning clinician. But sometimes there are cases where there's so many possible targets to look at, and sometimes I'll miss that, even though part of my typical screening is looking for those types of clues that might give an indication that there's one of these conditions going on. So I just mention that because it's just a good friendly reminder that there are some other underlying causes beyond things like mold and infections and things like that that can cause some of these symptoms. And the reality of it is that in some cases it's related more to genetics and connective tissue issues, hypermobility disorders and whatnot. In some patients it's very much acquired, and it's induced by mold mycotoxins affecting the brain, or heavy metals or viruses or things like that. So those are all still really important things to bear in mind, of course, but sometimes it's having those insults to the body are having a very specific effect on the autonomic nervous system, these blood pressure, heart rate dynamics, and it can cause just profound symptoms. And the kind of the good news around it is that there are certainly exceptions to the rule, but by and large, most patients notice quite a significant improvement in how they feel when those issues are starting to be addressed. And there's different tools that we use to do that. But I'm seeing that my time is running on here. I'm almost at the 5-minute mark, so I'll leave the video there. If there's any follow-up questions on this topic or anything else, please post them in the comment section below, and I'll do my best to answer them if I can.